Greetings, everyone. This is Miss Gibson. So this is part 2 of lecture 4, continuing with the immune system. So this lecture, we're going to discuss childhood communicable diseases. The first one that we're going to go over is measles. Early signs of measles, you're going to have fever, malaise, discomfort, cough, inflammation of mucous membranes in the nose. The incubation period is 10 to 12 days. Appearance of rash comes around day 4 after the exposure. Rash usually reaches the feet around the 5 to 6 day mark. With the onset, the child could have cough, cold, conjunctivitis, and or fever. The acute phase, a rash appears on day 3 to 4 after onset of symptoms. Rash will begin on the face and spread. It lasts up to 7 days. May also have some GI symptoms. Medical management for this, of course, is going to be prevention. You want to make sure that they have their vaccines and are up to date, usually around 15 months, and then again at 4 to 6 years of age. You're going to give them antipyretic medications as well as bed rest. Now, the gamma globulin is a vaccine given to children who have been exposed but not yet vaccinated. That protection lasts up to 3 months. Next is rubella. This is the German measles, now considered eliminated in the United States since 2004. You have to come into direct contact with secretions, indirect with fomites. Incubation time is 14 to 21 days. The communicable period is 7 days before to 5 days after rash appears. You're going to do supportive treatment and droplet, airborne precautions, not droplet, it should be airborne. Clinical manifestations, you're going to have milder symptoms than the measles, lymphadenopathy, fever, sore throat, rash begins on the face and then spreads, disappears in the same order. Rarely is there complications from this. Medical management, of course, you want to make sure they're up to date on their vaccines. If they have a fever, give them Tylenol. Protect pregnant women and unimmunized children, and they'll also be in droplet precautions. Next, we have Rosella. Sorry, that sounded really weird. This is the human herpes virus type 6. Occurs in children aged 6 to 24 months. There is a sudden onset. They'll have a high fever. Rash appears after the fever returns to normal. The rash lasts 1 to 2 days. Next, you're going to have the erythema infectiosum. This is 5th disease. This is the human parvovirus B19. It's transmitted through respiratory secretions as well as blood. Incubation may be up to 20 days. They'll have fever, headache, malaise, and pharyngitis. With 5th disease, The acute phase of rash will appear in 3 stages. The first stage, red rash on face, can be referred to as slapped cheek. This fades in 1 to 4 days. The second stage is a lace-like rash on upper extremities spreading to trunk. This usually lasts about 1 week. The third stage is rash can reoccur periodically in response to heat, sunlight, and cold. Medical management, supportive, acetaminophen for fever. They'll be in droplet precautions. Teach good hand washing, and then soothing baths or oatmeal baths. Scarlet fever, this is if they come into direct contact with respiratory secretions. Droplet and contact precautions will need to be used. Incubation period is 1 to 7 days. It is contagious for 10 days but can persist for months. Clinical manifestations: abrupt high fever, vomiting, abdominal pain, headache, fine red rash with sandpaper appearance. Tongue is coated. It'll be referred to as strawberry tongue. Tonsils are edematous and covered with exudate. Medical management, they'll have an order for penicillin or erythromycin if they're allergic to penicillin. And then, of course, analgesics, bed rest, fluids, and they'll be on droplet precautions. Diphtheria, this is transmitted through respiratory secretions. They'll be on droplet precautions. Clinical manifestations: thick covering in the back of the throat may cause difficulty breathing, nasal discharge, and it can be deadly. Medical management: penicillin or erythromycin, possible tracheostomy for obstruction. They'll be on droplet precautions. They'll be on a liquid or soft diet due to the throat issues. And then you want to observe for respiratory distress. Make sure they have a patent airway. Mumps, this is if they come into direct contact with respiratory secretions. The parotid glands swell. Chewing aggravates the pain. They'll have fever, malaise, as well as headache. Medical management, of course, vaccination with all of these. Supportive care, which would be acetaminophen for the fever, analgesics for pain. IV fluids may be needed. Ice pack or heating pad for the swollen glands. Bed rest, and then droplet precautions. Pertussis or whooping cough, transmission is through direct contact or droplet. Incubation time is 7 to 20 days. They'll be given antimicrobial treatment. Complications can be pneumonia, or it could cause seizure activities. Medical management, they'll be vaccinated or should be vaccinated at 2, 4, 6, 15, 18 months, and then between 4 to 6 years. A Tdap is given at age 11 to 12, and then Tdap for adults. Antimicrobial treatment for 7 to 10 days. Anti-seizure treatment. Hospitalization may be required. Strict hand washing, and then monitor for airway obstruction, just because the airway will become inflamed from all the coughing. This infection causes uncontrollable and violent bouts of cough, leading to extreme difficulty in breathing. And it literally sounds like they're whooping. Woof, woof, woof. is how that sounds. If you ever hear it once, you'll never forget how it sounds if they have true whooping cough. The littles are terrible, and they're very sickly. They become very tired very quickly from the coughing. This is poliomyelitis. Only 5% of infected people will develop flu-like symptoms. Only less than 1% of people infected with polio develop muscle weakness, fever, headache, fatigue, nausea, vomiting. Polio treatment through the years, iron lung, negative pressure ventilation to compress and depress the lungs, stimulating respiration. So they have to stay in this iron lung. I think it's like 23 hours a day or something. And it does help them to breathe. That's pretty much what's keeping them alive. Hand, foot, and mouth disease. They'll get a fever, blister-like eruptions in the mouth and or skin. Usually it's hand, foot, and mouth is where the rash is. Poor appetite, sore throat, supportive care, good hand washing. Very contagious. You see this a lot with kiddos that's in daycare. It usually, starts on their hands, but sometimes it can start their mouth as well. And then, like I said, you just give supportive care, Tylenol to help with the discomfort. Mononucleosis, this is seen a lot in teens. Epstein-Barr virus causes mono 35 to 50% of the time. It can remain dormant, and it is referred to as the kissing disease. It can cause central fatigue, loss of appetite, malaise, headache. The tonsils become very swollen and red. The patient may also get white patches on their tonsils. The spleen can become enlarged, so if they are tested positive for mono, they will generally the healthcare provider will want them to stay away from any contact sports. Can cause nausea and vomiting, high fevers, chills, body aches. The lymph nodes will also be swollen as well. Complications, you're going to monitor for signs and symptoms of splenic rupture. That's why the healthcare provider will generally want them to stay away from contact sports. If they're having lower left upper quadrant pain or left shoulder pain, you want to monitor for splenomegaly due to that spleen enlargement. All right, guys, that is the end of your lecture 4 with childhood communicable diseases. If you have any questions, feel free to email me. Have a great day.